What's going on with my patient? I have two patients. Both have EDS, both are women, both are in their 40s.
So let's break some things down and define why these involuntary muscular contractions are happening. We're going to do some differential diagnosis for these ladies and look at the movement disorders that are possibly associated with what's happening during their sleep. So the overall category, we could call it sleep-related movement disorders. And of the different types of sleep-related movement disorders, there are things like periodic limb movement, restless leg syndrome, which many bendies suffer from that, also people with fibromyalgia. Remember that these people do not have very good REM sleep, okay? Deep sleep is not their jam. There is also narcolepsy, REM sleep behavior disorder, and sleep-related breathing disorders, which do absolutely happen in people with EDS because they have low muscle tone, their tongue is not exempt. But I want to show you this. Electrophysiological abnormalities are present in 50% of the cases. Now, they are not saying this, but hear me out. If his women are in their 40s and 50s and they have mast cell disorder and EDS, a comorbidity that oftentimes goes with EDS is POTS. People that have POTS need electrolytes. Electrolytes equal electricity. If you have an electrophysiological abnormality, dare I say your magnesium and potassium could be in the toilet. One of the best things that you can do to experiment with is try electrolyte packets. If one is not enough, try two. Try one you like. Some of my patients swear by coconut water from Costco. Some of my patients swear by Element. Some of my patients love Liquid IV. I can actually tell you when Liquid IV came onto the scene, it was a game changer for my patient. Now, I didn't tell them to do this. They figured it out. Now, Element has salt in it. Liquid IV, salt, sugar. But the thing that happens with the electrical physiology here that we're talking about is the magnesium and potassium, because magnesium is a muscle relaxer. Another thing that you could tinker with when people have contractions at night is taking magnesium glycinate. Magnesium helps with over 300 processes in the body, and it's a big deal for muscles. So if we want to talk to the people about their REM sleep behavior, we need to get more metrics. We need to find out about their sleep. I wear a Whoop. My Whoop tracks my sleep, I track my habits, I track and see, do I get my deep sleep? Because I'm willing to bet they're not getting their deep sleep. If we want to look at a differential diagnosis of movement sleep disorders, here's a whole list. I'll get out of the way. So in conclusion, I feel like we got to ask more questions. Are you taking magnesium? Are you doing electrolytes? Are you staying hydrated? Are you getting sleep, REM sleep? And because they're in their 40s and 50s, we know that their estrogen could be going into the toilet because estrogen helps a lot of things. Estrogen helps our brain. It is neuroprotective. It also helps us broker inflammation. So these women could also have a hormone imbalance, which is waking them up. And maybe they are noticing these movement patterns more, which maybe they've been there all along. So my Women's Health Inquiry Mind wants to know, where are they in their perimenopause, menopause journey, and how are their hormones? How's their magnesium? How's their electrolytes? Are they hydrated? Are they sleeping? And if we ask those questions, we might have a better answer.